amount of weight that you're pulling traction on the patient. For the amount of mass that they weigh in pounds, right?
Yes.
Yeah, so in pounds, you're going to apply a tenth of that amount of traction. So if she weighs 100 pounds, you're going to apply 10 pounds of traction. Now the maximum is 15 pounds of traction. So the maximum traction you're going to pull is 15 pounds. So if the person's 200 pounds, the maximum you're going to pull is 15 pounds of traction in this class. Okay. So when you apply this device, it's kind of tricky in the sense that this needs to be facing outwards. So you're not going to be placing the device with the dial facing inwards if it's a left leg injury, right? The two directional things is this has to always be facing outwards, the gauge has to always be facing outwards, and so the D-ring always has to be on top. So, the D-ring, right? This needs to be on top and this needs to be facing outwards. So if it's a right leg injury, for instance, this wouldn't work and you'd have to make some adjustments. The adjustment can be made by taking this top part off. There's a little button. Push the little button and the top part slides right off. You flip that around so the D-ring is always on top. The top part is adjustable. Okay?
Guys, please don't come back in like 3 months and not know how to do this. We just tested one of Victor's who, you know, and we'll switch the leg when we do the finals, and so you'll have to know how to switch that on the device. Please don't come in and go like this. I really don't know why it's not working. It's really simple.
Right. It's always outside, the D-ring's always on top. If you want to switch it, flip it around, and this thing is bendable to accommodate for the left. Alright. So for this instance, we're going to say the left leg injury. I was going to mention something. Oh, so I mentioned earlier, so there's 3 straps. They're all different length straps. That is also important. So you're going to have longer or if the straps are going around the legs, where do you think the longer strap's going to go?
Top.
Exactly. So that's going to be going higher, lower, or I think these two are about the same. Yeah, so these two, one just goes over the knee and one goes below the knee. Right, but you always want to make sure you have the longer strap up top. Okay? So, the other side is being safe. Okay. Site of the injury for this, again, it's going to be mid-femur fracture, so I'm going to have for the left leg, for this particular patient. She's wearing her shoe. I'm going to have my partner go ahead and manually stabilize the site of the injury, cut and cover, and then, you know, you have them maintain that while you pull the pants, or that legging off. You're going to remove the shoe, and it says PMS, and a sock. Pulse.
Present.
Can you go ahead and wiggle your toes for me? Which side of your foot am I touching?
Inside.
From there, it's still being manually stabilized, so you have a few seconds to go ahead and get your equipment ready. Just so not run out of time, go ahead and have your 3 straps kind of laid out already. The way that you want to apply them. From there, again, this is on the other way, just flip it around to make sure the D-ring is on top and the gauge is pointing laterally. From there, you're going to go ahead and, for this particular device, you're not going to be measuring it up until the device is already on the leg. The hair, you measured up beforehand, right? So for this one, you're sliding it in between the leg. Again, you're not going over the patient, you're not going over their head, you're going around their leg, and you're going to slide it into place.
And another difference from the hair is that you're not pulling manual traction on this station.
Right.
Your skill sheet is the same for these 2 stations, which is kind of confusing. So make a note on it that with the Sager, you do not, this is what's called a unipolar traction device, and the other one is the bipolar, because it has 2 pulls and not one has 1.
I'm kind of on that note, so I've been told that we're not pulling full traction in this class, which means that you're not pulling the full amount, you're not pulling 15 pounds, you're just pulling until it's snug, and you're going to verbalize how much traction you'd be pulling. So if I weighed 150 pounds, you'd be pulling just enough traction where there's tension on it, but you'd be verbalizing, I'm pulling 15 pounds of traction for this particular device to the proctor. Okay?
So no manual traction and no measuring necessarily.
Right. So you're going to slide this into place. And same thing for this, you're going to have an ischial strap that you want to secure up as high as possible. So in order to do that, you're going to be sliding it almost all the way up there. And if they have a shorter leg or whatever, or if they have a longer leg, and the device is going to hit the ankle, go ahead and about, I don't know, 6 inches or so, just to avoid hitting the ankle until you're ready. Then you're going to start securing the strap. Before you secure the strap, obviously, you know, that's going to be a sensitive area for some people, right? So you're going to go ahead and have to notify them there's going to be pressure on the area, and if they need to make any accommodations for it, then now would be a good time. Remember, you're going to feel some pressure on the inside of your thigh, on the upper leg, on your upper thigh. Go ahead and let me know if it's too uncomfortable for you, and we can try and work something out. That's especially important for males, obviously, right? Okay.
Yeah. You can ask your patient if he feels the need to adjust at this point in time. It's
Right.
a good time to do it. So just be sure that you're polite about it. Even in class,
Right.
I know that you will get dinged and dinged hard if there is crass or foul language
Right.
around this kind of activity. So.
And again, this will still be manually stabilized because it's being stabilized from the very beginning. So you're going to slide the strap up as high as you can. Once it's as high as you think you can get it, you're going to start start securing it down with the push-pull maneuver. From there, you're going to go ahead and secure the ankle strap. It's pretty much the same concept as before. You're going to have the hook, which is going to go over on top of the leg. You're going to slide the strap under the leg, but this time you'll notice how close the device is to her ankle. You don't want to secure the device down when you strap. You don't want the strap to go over the device. You want the strap to go under the device. So you're going to slide that over the foot, and you're going to be careful to not move the leg excessively. You're going to slide the strap under the Achilles tendon. And you're going to pull the strap up in between that and the device and the leg. If they have a thicker leg, you're going to have these cushions to accommodate for it. If they have a thinner leg, you can just pull it out to make it a little bit tighter. Right? So from there, we're going to go ahead and secure this as best as possible while trying to maintain the leg and have minimum movements. You're going to secure that as tight as possible. So that's pretty much it as far as getting this device secured and ready to go.
Yeah, and if you do feel like you're going to have to like jostle the leg or move it at all, be sure and tell your proctor, I have my partner stabilizing so that we can make this very minor movement to accommodate for this. But again, if your invisible partner isn't talked about, then they won't exist.
So from there, this is the point where you're going to go ahead and apply traction. So you're going to let your patient know that you're going to have to know their weight with the intention of being able to pull the right amount of traction. You don't want to embarrass them because some women, or most women, are programmed to not say, not lie about their weight. So when you do ask about their weight, you want to be you want to note that, it's pertinent to applying the appropriate amount of traction. So, ma'am, in order for me to apply the appropriate amount of traction, I'm going to have to go ahead and ask you your weight.
140 pounds.
140 pounds. So how much pressure are we going to be applying? 14 pounds. So for this, we're not pulling full traction. Click, click, click. I'm setting it to 14 pounds. You're going to be notifying, telling your proctor I'm pulling traction. I'm pulling 14 pounds of traction on the device. From there.
I have a little comment.
Yeah, please.
Sometimes at state they've had people actually pull traction because 15 pounds is not very much, just because they had a couple of injuries to somebody who had prior injuries to their knee and stuff like that. So now we're kind of going away from it. But I want you to be prepared for state. So when you go into this, if you draw one of these are random. Ask the proctor, am I gonna pull traction? And if she says yes, you need to pull traction, and you cannot lose traction at any point during the station. Okay? Which means that if you pull 15 and you end up with a result of 13 or 12, then you're done. Okay? So you have to be prepared for this. So I don't really know how we're going to practice that.
Here's who will cover your ass for that, right? And for all of you that just videotape that part. So cover your rear, how's that? When you are at state and you're sequestered in the fire bay, and you should, because the minute I say you will, I just jinxed you all, right? You should have the skill sheet along the fire bay doors. So the only skill sheets you'll have up there are the ones for whatever random stations are going to be there for that day. If traction is one of them, your certified officers are going to come in and they're going to redo the spiel about how the day is going to go and what the expectations are. Do you have any questions? Perfect time to be like, so just a question about the traction. Do you want us to physically pull traction at this station, right? You should have the option of either one. I personally want you to have experience in both, because if we only have 5 Sagers, and that's the one you really like, and that's the one you only know how to use, and one of them breaks the night before the state exam, what do you think your choices are going to be? Repair. That's it. There's no choice anymore. Does that make sense? So you can have your preference, but you need to know how to work both, just in case something horrible happens the night before the state exam.
And you're
Okay.
also allowed to tell your certifying officer that in your class you haven't been taught to pull a traction, which means we can't expect as state, as evaluators, we can't expect you to do something you've never done either. So make sure when they're doing their whole hour-and-a-half spiel, make sure you ask that question.
If that's one of your options, definitely ask and see what their response is. You can let them know. Ultimately, it's their call at the end of the day, right? But just, it's one of those that to cover your rear, go ahead and ask. Do you want us to actually pull? Because in class, we didn't. And maybe you go ahead and do the hair one at that point, because you don't need to worry about the pulling of that traction at that point.